Adlerian Theory, Megan Anvender, CP 612, Dr. Wagner. Table of contents. Who founded the theory? Where was it founded? What was going on in the world at the time it was founded? Key concepts and words to know. What causes hurt and suffering? What prompts change? Discussion points. Sources. Who founded the theory? The Adlerian theory was founded by Alfred Adler. He was born in 1870 and died in 1933. He grew up in Vienna with a family of 6 boys and 2 girls. His brother died at a young age, and Adler was in the bed next to him. Alfred's early years were characterized by struggling to overcome illness and feeling inferior. He was determined to overcome his physical limitations. Adler went on to become an ophthalmologist. He eventually specialized in neurology and psychiatry, with a keen interest in childhood diseases. He was outspoken about child-rearing practices, school reform, and prejudice that resulted in conflict. Adler created 32 child guidance clinics in the Vienna public schools and began training teachers, social workers, physicians, and other professionals. He pioneered the practice of teaching professionals through live demonstrations with parents and children before large audiences. Where was the Adlerian theory founded? Adler resigned as the president of the Vienna School of Psychoanalytic Society in 1911 and founded the Society of Individual Psychology in 1912. Freud at the time said it was impossible to support the Adlerian concepts and still remain in good standing as a psychoanalyst. A number of other psychoanalysts deviated from Freud's orthodox position. These Freudian revolutionists included Karen Homey, Eric Form, Harry Stack, Sullivan. They all agreed that the society and cultural factors were a great influence and significance in shaping personality. Adler emphasized that where we are going is more important than where we came from. What was going on in the world at the time Adlerian theory was founded? When Adler separated from Freud, he enjoyed a considerable amount of success and celebrity in building the independent school of psychotherapy and a unique personality theory. His intent was to build a movement that would rival, even supplement others in psychology by arguing for the holistic integrity of psychological well-being with that of social equality. Efforts were halted by World War I, during which he served as a doctor with the Austro-Hungary army. After the war, his influence increased greatly. Key concepts of the Adlerian theory. Adlerian had views on human nature. Adlerian theory stresses assuming responsibility, creating one's own destiny, and finding the meaning and goals to create a purposeful life. Adler abandoned Freud's theory because he believed Freud was narrow-minded in his stress on biological and instinctual determination. Adler believes individuals begin to find an approach to life somewhere in their first 6 months of life. The person's perception of the past and interpretation of early events has a continuing influence on a person. According to Adler, humans are motivated by social relatedness rather than sexual urges. Behavior is purposeful and goal-directed. Consciousness more than unconsciousness is the focus of therapy, and choices and responsibility. Theories of personality. Style of life, how an individual adapts and overcomes challenges formed by early childhood experiences, usually formed by age 5, birth order, and family personality, social interests, aptitude, and ability. Starting early in life, people expressions of cooperation through activity is used to measure for mental health abilities and capabilities. So low social interest equals poor mental health. High social interest is better mental health. Inferiority, which is something that everyone experiences in life. So that could be due to a perceived weakness, a physical limitation, or social inferiority. And if we don't find a compensation for this, an inferiority complex occurs in a feeling of inadequacy and feeling worthless. On the contrary, we have superiority theory, which is a striving for excellence, which is good and positive and healthy. But an overinvestment in this can create a superiority complex, which can end in arrogance and demeaning of other people and self-centeredness. Individual psychology is understanding the whole person in context of their life, how all of these components are unified by individuals' movement toward a life goal. Lifestyle. Our perception regarding ourselves and others in the world includes connecting themes and rules of interaction and giving meaning to our actions. Causes and symptoms. So Adlerian Theory says that personality begins to shape at 6 months, and it's fully developed by the age of 6. So Adler believed that the misbehaving child was a misunderstood child. Rather than believing clients suffer from pathology, Adler contended that clients are simply discouraged. Therapy focuses on encouragement and building self-confidence. There's also a theory of mistaken beliefs or faulty values and useless or self-absorbed goals. So trying to achieve something that might not be for the correct purposes. So discouragement is the lack of courage. There's also a feeling of inferiority. So Adler focused a lot on the relationship of siblings and that dynamic. So something that an oldest child might feel is inferior when a little brother or sister comes along and steals some of the attention away. So they have to overcompensate and be the perfect child and in order to get attention from the caregiver. The second born or middle child feels a continuous amount of competition from the oldest child and will try to be successful in ways that the eldest was not. And the last born child may develop a helpless attitude from being spoiled throughout life and kind of having older brother and sister and mom and dad taking care of everything for them. And then the only child develops the need to be the center of attention in all scenarios, and in work and in their adult life that might be discouraging when they don't get attention, and they may become dependent on parental support or encouragement. What prompts change according to the Adlerian theory? So for this one, I was going to focus on the counseling process. So the first step in the counseling process is to build a rapport or mutual respect with the client. Focus on the person, not the problem, and assist the client in defining their goals. Step 2 is assessing individuals' psychological dynamic. So there's a subjective interview where you learn the client's life story, and then an objective interview where you learn how problems began, precipitating events, the medical history and medications used, social history, reasons clients chose therapy, how a person copes with life tasks, and lifestyle assessment. So there's also in this process a family constellation dynamic where you learn about the client's childhood. You learn early recollections and feelings associated with early memories. So if their early memories are kind of negative and them getting yelled at by parents or fighting with siblings, etc., those kind of help shape a child's outlook on life. And then understanding the individual's identity and how it fits into the world. So basic mistakes, self-defeating attributes or behaviors, expressions, minimize own self-worth, negative view of life and incapable of accomplishing goals, overgeneralizations like everybody hates me, and then learning strengths and weaknesses of the client, family relationship and birth order, which I think is fascinating. I've always been fascinated by this. And Adler says that the only child tends to be not cooperative with other children and forms useful relationships with adults, which in children that I know that are only children, I can see these sort of aspects forming. And then I am the oldest, and it says the oldest is the favorited or center of attention and spoiled, which I would disagree with that. But some of the attributes that I am more driven to with the oldest child is I can see the perfectionism and the need to always, do my best, and also the caregiver aspect of it, like always taking care of my little brother and sister. And then, which is kind of why I'm choosing to be a counselor and a teacher. And then it says the middle child, the second out of two is in competition with the oldest child. And I could see that in my little brother. I think he was always trying to live up to me and kind of just fell short. So that really hurt him in life. And then the middle child is also pushed out of the family, which I disagree with because I think my brother is my mom's favorite. But that also might be because it's the only boy and she identifies more with men just because she has all brothers, and my brother kind of struggled a little bit, so I think she kind of has a little special spot in her heart for that. And then the youngest is often rebellious, which I can see that in my sister, but I can also see that in myself and my brother. And then the youngest is also spoiled, which I can for sure see in my little sister. So dreams also gain insight into current style of life, and then understanding the meaning of thoughts, feelings, and behavior. Step 3 is encouraging self-understanding and insight. This is where the therapists interpret the findings of the assessment to promote self-understanding and insight. And the techniques Adler uses overall encourage self-understanding. He believes humans are motivated by social relatedness. Behavior is purposeful and goal-driven. He focuses on consciousness more so than unconsciousness, and feelings of acceptance and respect. So one of the techniques he uses is role-playing. So the counselor helps the client practice behaviors that they want to exhibit in real life. And then the acting as if technique. So this is where you act as if the new behavior will be successful. And then the push button technique, which is kind of what Adler is known for. So this is a cognitive recall where you recall a pleasant memory and feelings associated with them, and then a difficult time and identify the emotions associated with them. So pretty much you would have the client close their eyes, think of a difficult time, the feelings associated with that, and then you would push on one of their legs, and then you would have them close their eyes and have them recall a positive memory and push on the opposite leg, and kind of a notion of like, if I press this button, then I have positive feelings type of thing. And if you repeat that enough, then it becomes kind of ingrained into their memory. And then catching oneself. So that's where you detect an undesirable behavior and stop them before they happen. And then paradoxical intention. This is strategic family therapy. Specific behaviors are exaggerated. So you can kind of learn the faults in these behaviors. And then they also gain insight. And then there's a homework. So this is always tied to a behavior goal. So the goals are to change self-defeating behaviors, increase social interests, and then problem solving, and creating more adaptive styles of life. Discussion points. So I was going to go over these questions and answer my views after learning about the Adlerian Theory. So first question is, how would a client benefit from using Adlerian Theory? I think the Adlerian Theory is all-encompassing, so it kind of focuses on the here and now and then also the past. So I think that can be very beneficial for a person. And it also has goals. So that is something that I think people need to understand. And I think it's kind of like a good fix. Like if you get through Adlerian Theory, I think you would be kind of set for life because it is all-encompassing. And then what are some downfalls to Adlerian Theory? The main downfall that I heard was that it takes a while for Adlerian Theory to kind of go through its course. So a client that's looking for a quick fix, I know I am very impulsive, so I kind of want to like get it done now. So I don't know if I would be on board with all of this, but I'm also very interested in, if I would go through Adlerian Theory, what sort of views they would have on my childhood experiences and kind of how that shapes me as the person I am today. And then what are some aspects of this theory that you will try to use in your practice? I think definitely building rapport with a client and seeing the client as like a mutual member. I think that's important because I hate, thinking, you're better than someone. I think that's a real turnoff for some people to see a counselor. And then assessment, the assessment process, using the subjective interviews, learning about the client, and then the objective interviews of how the client thinks and why they think that way. Those are things that I think I could see myself using. And then as far as techniques, I really liked the role-playing technique, and then catching oneself, and the push-button technique, which I think the push-button technique would work really well with my students, thinking about negative experiences and just even as a class, and having on the board and saying like, okay, this is negative, and pointing to the negative one, and having the kids have a little cursor on their desk and they can kind of see that too. I think that would be helpful. And then of course talking about the positives too, like something positive that happened with the kids, and pushing the positive buttons on on my teacher chalkboard, and then also on their desk. Having those visuals is really helpful for kids. And then what are your favorite parts of the Adlerian Theory? I think that my favorite parts really align with the ones that I would probably use in my practice. So the role playing and push button technique. And I really liked that he focused on sibling relationships. And because I'm a teacher, I always love the homework and then the goals associated with things, because I like, having something concrete that we can see, that we can work towards. And I think that's really beneficial for a lot of people. So those are my thoughts on the Adlerian Theory. Thank you.